This is me Arju here and I welcome you to my channel Mr. Teeth, where your dental concept get dissected. So as you can see, today we will be discussing about the silicate cement. Okay, we are studying the dental cement. So in this dental cement series, okay, this is our second lecture of dental cement series. Okay, so in this second lecture we will be discussing about the silicate cement and we will cover this topic in full detail. Okay, I have included all those important points. Okay, all those important things that are to be studied in this chapter. Okay, so without delaying much, let's start today's video. So as we can see here, at first I have discussed about little bit about the silicate cement. Okay, I have given little introduction about the silicate cement. Okay, so let's start with this ADA number. So the ADA number of the silicate cement is, so the ADA number of the silicate cement is 9. Okay, and it was discovered by the Fletcher in 1873. Okay, so as I discussed in my previous video. Okay, so there I have discussed all the cement with their inventions. Okay, in their particular date form. Okay, so in 1873 Fletcher discovered the silicate cement. Okay, similarly in the anterior it is primarily, okay, used for the anterior tooth filling material. Okay, similarly it is use of the dental cement was widely began with the use of silicate cement. So this I want to explain much, okay, in this point. So at this silicate cement was the first discovered cement, okay, in the history, okay, by the Fletcher. So at that time, okay, at that time dental amalgam were being used. Okay, but at some people or some group of people thought that dental amalgam would be toxic to our body, so it was primarily replaced by the silicate cement. Okay, so silicate cement where the use of the cements used were started by this the invention of this silicate cement. Okay, so it is translucent and resembled porcelain in appearance. Okay, so aesthetically also this silicate cement was better. Okay, so the people started using this silicate cement over the dental amalgam. Similarly it is over a period, okay, silicate degrades and stain, okay, leakage around. Okay, so when we restore the silicate cement in the anterior tooth, okay, but it appears it is aesthetically okay at that time, but after the time spent, okay, after the time is lost, okay, after over some period of time, okay, there is a degradation of the silicate, okay, and staining is happening on that tooth. So also there is a leakage, okay, through the margin. So there is also presence of the marginal leakage. So just you guys to remember is that there is a marginal leakage with the time. Similarly there is degradation of the silicates, okay, over the time. Okay, so you should remember those points. Okay, similarly the average life of the silicate cement is 4 years and it is anti-corrosive property. Okay, it have anti-corrosive property, means it releases the fluoride. Okay, now we will study about the constituent of the silicate cement, and in constituent of the silicate cement I have prepared a proper table. Okay, so the column, one column is of powder and another column is of liquid. Okay, so in our first column of powder, so the main constituent of the silicate cement is the silica, as it is named silicate cement. Okay, so it must have the silica. Okay, so silica, the formula of silica is SiO2. Okay, you guys shouldn't remember this, okay, but you should remember this silica is a major component and the percentage, okay, that is present in this silicate cement. Similarly another major component is alumina of the powder, that is Al2O3, okay, that is 30%. Another is cryolite, that is 14%. Similarly sodium fluoride and calcium fluoride, calcium phosphate and the lime. Okay, so they are the component of the powder. Okay, so if you guys can't remember all those points, okay, just you guys should remember is that silica, that is 40%, and alumina, that is 30%. Okay, and cryolite, that is 14%. So these three, okay, are quite important. Okay, also you can remember the sodium fluoride. Okay, so these four are the major constituents of the powder. So if sometime you forgot all those names, okay, just remember silica, alumina, cryolite and sodium fluoride. Okay, as a silicate cement came from this silica. Okay, so silica is a major constituent of the powder. Now we will study about the liquid. In liquid it contains the phosphoric acid, that is a major constituent of the silicate cement's liquid. Similarly the aluminum phosphate, okay, that is a 2%, zinc phosphate, that is 6%. Okay, magnesium phosphate and the water. Okay, so the two major component that is present in the liquid is, one is phosphoric acid, okay, and another is a water. Okay, and other component are also present. Okay, and all components are phosphates. Okay, so in this pattern you can remember. Okay, so one is phosphoric acid, another is water, and all other component are phosphate. Okay, so aluminum phosphate, zinc phosphate and magnesium phosphate. Okay, so I have prepared the mnemonic. Okay, so magazine. Okay, so you can remember this by magazine. Okay, magazine phosphate, M for magnesium phosphate and Z for zinc phosphate and A for aluminum phosphate. Okay, so you can remember in such a pattern, and phosphoric acid and water you can remember yourself. Okay, so I have covered this constituent also. Now I will discuss with about the manufacturing of the powder. Okay, how the powder are manufactured in the factory. Okay, so sometimes they can ask you in the viva, how is the manufacturing process of tell me the manufacturing process of the powder of the silica. So at that time you should tell in such a pattern. Okay, so just remember this temperature. Okay, that is 1400 degrees Celsius. Okay, so mixing of all the ingredients are mixed and fused at 1400 degrees Celsius. Okay, so the constituent that are present in the powder, as I have discussed earlierly, that is silica, alumina, cryolite, sodium fluoride, calcium fluoride. Okay, so all those ingredients are mixed. Okay, and they are fused at the 1400 degrees Celsius. And another point I have written that below 1400 degrees Celsius the sodium fluoride. Okay, so sodium fluoride that is present here. Okay, so as I have written here, so sodium fluoride, I also told you to remember this sodium fluoride is also important constituent of the powder of the silicate cement. So sodium fluoride. Okay, okay, so below the 1400. Okay, below the 1400 sodium fluoride melts, and that molten sodium fluoride dissolves other ingredients. Okay, so it is called a ceramic flux. Okay, so the melting point. Okay, so the melting point of sodium fluoride is below the 1400 degrees Celsius. Okay, so at that temperature itself sodium fluoride melts and it forms the molten sodium fluoride. Okay, and that molten sodium fluoride helps in, okay, and it dissolves other ingredients. Okay, so it acts as a flux there, so we call it as a ceramic flux. Okay, so this is very important question. Okay, so I would take this and you should remember this. Okay, so sodium fluoride act as a ceramic flux in the zinc silicate cement. Okay, sorry. Okay, now in aluminum phosphate is also present there. Okay, aluminum phosphate is present in the liquid. Okay, so aluminum phosphate can also act as a ceramic flux as like a sodium fluoride, but it provides the additional aluminum to the glass. Okay, it also provides the additional aluminum to the glass. Okay, so it can also act as a ceramic flux and provide the additional aluminum. After 1400 degrees Celsius there is a, okay, after when 1400 degrees Celsius is reached, okay, so after that we cool that mixer, and the mixer after when it is cooled, okay, there is a appearance of the cracks. Okay, so cracking of the glasses present in the powder. Okay, so that cracking of the glass is called fritting means cracking of the glass. Okay, so fritting helps in grinding the materials into the fine particle. Think that, so when we melt anything, okay, and that melted substance is cooled quickly. Okay, so quenching is done there. Okay, particular technical term is there, quenching. So cooled quickly, after when we cool it quickly there is a cracking of the glass. Okay, so cracks may appear there, and that cracks would help in the grinding of materials. Okay, so fritting helps in a grinding of materials into the fine particles. Okay, after that we will study about the setting reaction, and in the setting reaction the point you should not miss is that it is a acid base reaction. Okay, so setting reaction is by acid base reaction, and water is required. Okay, so water is required for the reaction. In the absence of water there won't happen this setting reaction. Similarly, the reaction between the phosphoric acid, that is a liquid, and the fluoroaluminosilicate glass powder. Okay, so there is primarily reaction. Okay, so there is primarily reaction between the phosphoric acid and the fluoroaluminosilicate. I have included this point here because, okay, so sometime in MCQ, what are the constituent, okay, that take part in the setting reaction of silicate cement? If they ask you, then you should remember this: phosphoric acid as a liquid and fluoroaluminosilicate glass. Okay, so as in a powder there is silica, alumina, sodium fluoride. Okay, so combinedly they are called fluoroaluminosilicate glass. Okay, so just remember this name. Okay, fluoroaluminosilicate glass. After that I have written it is an exothermic reaction, means there is a production of heat here, and it is carried in a particularly 3 steps. So setting reaction I have when you will look the books, okay, when you look the books or any other lectures, okay, you may be bothered. Okay, in book there is given anything, okay, in lectures they say anything. So I have prepared a proper 3 steps. Okay, 3 steps that is causing the setting reaction of this silicate cement. Okay, so our first step is initial acid attack stage. Okay, so in this stage, this is also called dissolution phase. Okay, so in this phase there is a attacking of the hydrogen ions. Okay, hydrogen ion that is released by the phosphoric acid. So just think that phosphoric acid, that is acid. Okay, so H3PO4. Okay, so H3PO4, that is acid, it releases the H plus, and that H plus would react with the phosphoric, would react with these glass particles. Okay, so when it reacts interact with the glass particles, and there is a release of the this okay, so there is a release of the aluminum, calcium, sodium fluoride. Okay, particularly what happens there that when H plus ion released by the phosphoric acid, it attacks the glass particle, and those glass particle replaces those ions, okay, aluminum, calcium, sodium fluoride from the glass particle, and they are released out in the liquid phase. So they come out of the glass particle. Now what happens is there, so that those ions that are released out in the liquid phase, okay, so those ions, okay, over the glass particle, they are hydrated, okay, over the, so the hydrated aluminum, sorry, so those ions, okay, that are displaced, they form the metal phosphate gel matrix. Okay, so this is important. Okay, so there is a formation of the metal phosphate gel matrix, or you should remember this. Okay, so acid attacked the glass particle, and from the glass particle there is a release of aluminum, calcium, sodium, fluoride, and those four ions, they again reacted with the phosphate, okay, and form the metal phosphate gel matrix called aluminum phosphate, calcium phosphate is formed there. Okay, similarly also what happens there is there is also a formation of hydrated aluminosilicate gel over the glass particle. So when these ions are released out, okay, so over the unreacted glass particle there is a formation of the layer, okay, that is hydrated aluminosilicate gel. Okay, I will be discussing with this in the structure of the set mass. Okay, so just remember, now there is a formation of two things: hydrated aluminosilicate gel over the glass particle, and metal phosphate gel matrix, that is formed. Okay, it act as a matrix like structure. Okay, so you will be clear when I will show you the picture of that set mat I have drawn here. Okay, so I have drawn here, so you will be clear when I will be discussing here. Okay, but now you just remember there is a formation of two special things, that is aluminosilicate gel over the glass particle, and another thing is the metal phosphate gel matrix. Okay, similarly when the pH is increased, okay, so by the increase of the pH, the phosphate and the fluoride are precipitated. Okay, just you should remember this. So when the pH is increased, okay, as the time is lost, as the time is spent, okay, so there is increase in pH. Okay, so it becomes little alkaline and moves towards the pH 7. So at that time phosphate and fluoride are precipitated. Okay, so they are precipitated. Okay, so just to remember this. After that, as I have written, our third phase, okay, that is hardening phase or the setting phase. So in hardening or the setting phase, you guys should remember is that, okay, that gel matrix. Okay, so first of all I will explain this, then you can understand it properly. So as I have told there, we have dissolution phase, and another phase is the precipitation phase or the gelation phase. So in the precipitation phase itself, okay, there is a formation of this like structure, and when it hardens, it forms a hard structure. Okay, so in this picture, as we can see here, there is a presence of the unreacted gel, unreacted, this is glass particle. Okay, so unreacted glass particle is present there. So the glass particle that is unreacted is present here, and that glass particle is surrounded by, okay, so this is structure is surrounding the glass particle, and that is aluminosilicate gel. Okay, aluminosilicate gel is there. Okay, similarly, and this whole structure is present in a matrix. Okay, and that matrix is of aluminophosphate gel matrix. Okay, so metal phosphate gel matrix is present there. Okay, so as I have given effort in this, so you guys should remember this. Okay, so it is easy to remember. Okay, now our third stage is setting phase. In setting phase, gel matrix continues to harden, okay, forming a rigid and a brittle structure. Okay, and water is still required in this phase as it acts as a medium for the ion movement. Okay, so just remember those 2 points. Okay, so water is required in this phase too also, and the gel matrix continues to harden, forming a rigid and a brittle structure. Okay, now after I have completed this setting phase reaction, now I will discuss with the notes. Okay, so they are very important points, so they can directly ask in the viva. Okay, so as we know that, okay, there is a low pH. Okay, so there is a low pH, it is more acidic. Okay, it is highest acidic, it is a highly acidic, okay, highly acidic cement that we have, so it have a low pH during setting, so that due to its low pH, it causes the pulpal irritation. Similarly, the reaction of setting reaction is our exothermic, causes the thermal sensitivity. Similarly, there is a fluoride release, and due to the fluoride release, it offers the anti-carcinogenic benefit. Okay, so just remember these 3 points: exothermic, it causes thermal sensitivity; fluoride release is the anti-carcinogenic benefit; and low pH during the setting causes the pulpal irritation. and setting time is 3 to 8 minutes. Okay, and factors that are affecting the setting time. Okay, so I have mentioned 5 factors. So the particle size, if it is smaller, then the setting will be fast, and okay, there is a rapid setting. Similarly, mixing time. So if there is prolonged mixing time, if you mix the cement for the longer time, then there is a slow setting. Okay, similarly, temperature, when it decreases, there is a slow setting, and loss of water from the liquid. Okay, so there is a slow setting. Similarly, the lower powder by liquid ratio, it also causes the slow setting. So we have 5 measure points: particle size, mixing time, temperature, loss of water from the liquid, and lower powder to the liquid ratio. Okay, after that, the one main important thing, okay, that you shouldn't miss, that is a contact carries. Okay, so contact carries means those carries, okay, that are occurring on the proximal surface of the tooth adjacent to the restoration. Okay, so when we prepare the class 2 tooth preparation, okay, so in class 2 tooth preparation, we used to fill the restorative material. Okay, it builds the contact. Okay, we fill the restorative material in a such a way by building a contact over the other tooth. Okay, so at that portion there is a occurring of the contact caries, and this contact caries is mostly occurring when the restoration is of dental amalgam. So at that time, as I have told earlier, at that time there was the race. Okay, there was a competition between the silicate cement and the dental amalgam. Okay, so some people say that dental amalgam would cause the contact caries, but silicate cement doesn't cause the contact caries. So it also cause, okay, but there is less occurrence of the contact caries by using the silicate cement. Okay, but it is more in the amalgam restoration. Okay, so just you remember contact caries. Sometimes they can ask in Baba, what is contact caries? Okay, so caries that occurs in the proximal surface of the tooth adjacent to the restoration. Okay, so now we will discuss about the properties of the, okay, so now we will discuss about the properties of the silicate cement. So in the properties of the silicate cement, I have written total okay, this is 7. Okay, so 7 properties I have written here. So our first property I will discuss with the mechanical properties. Okay, so in the mechanical properties, as we can see there, there is a high compressive strength but the low tensile strength or the flexural strength. Okay, so you should remember this silicate cement have high compressive strength but the low tensile strength. Okay, so the data is 180 MPa and the low tensile strength, and that is 3.5 MPa. Okay, so hardness is similar to the dentine. Okay, and which is the 70 noob hardness number. Okay, so you can remember these two. Okay, so high compressive strength, low tensile strength, and hardness that is similar to the dentine, which is 70 noob hardness number. Okay, similarly the moderate abrasion resistance is also present in this cement. After that, in thermal property, it have a high thermal conductivity. Okay, it have high thermal conductivity, and the coefficient of the thermal expansion is equal. Okay, equal or close to the enamel or the dentine. Okay, so you should remember this. Okay, it have a high thermal conductivity, so that in the deep cavities, okay, when we use this silicate cement, okay, this is also a disadvantage of this cement. Okay, so I will be telling you later that some teacher may ask you, they tell me the advantage and the disadvantage of the silicate cement. Okay, so you can take this from this properties itself. Okay, as in the properties I have mentioned all the point. Okay, so the thing that sophistication, okay, that are the advantage of the silicate cement, and the substances, and that properties, that is a hindrance to, okay, that is a hindrance to the tooth structure, that is a hindrance to the patient. Okay, it is causing some harmful effect, that is a disadvantage of the silicate cement. Okay, so from these properties itself you can take those advantage and disadvantage, so you should study this properly. As I have told, in a mechanical property, so in the disadvantage section you can say that it have low tensile strength. Okay, so this is also one of the disadvantage of the cement. Similarly, in the thermal properties, as it have a high thermal conductivity, so when we fill it as a restorative material in a deep cavities, it would cause the transfer of heat from the oral cavity towards the pulp. Okay, so it can cause the pulpal necrosis. Okay, so thermal sensitivity, thermal conductivity is high there, so it can cause damage to the pulp. Okay, after that, the coefficient of the thermal expansion is equal or close to the enameller dentine, so it is an advantage. Okay, so you can say this as an advantage. Similarly, in the biological properties, as I have written here, it is extreme pulp irritant. Okay, initial pH is 2.8, and after 1 month there is increase in pH, but that is also less than 7 itself. Okay, so after a few time also it have pH that is acidic itself. Okay, so it is a highly acidic cement. Okay, similarly it releases the fluid, so it is a disadvantage and it is an advantage, so you can separate like that. Okay, so it is extreme pulp irritating substance and it releases the fluid. Okay, so it is anti-cariogenic, and how the fluid stops the caries? Okay, by three way. Okay, so that 3 ways are one is antibacterial, okay, so it is antibacterial, and another it inhibits the enzyme, okay, so it is enzyme inhibitor too. Similarly, it prevents the carbohydrate metabolism, okay, so it also prevents the carbohydrate metabolism. After that, I have written about the solubility and the disintegration, and in the solubility and the disintegration portion, okay, so it is high, and the rate of solubility is 0.7%, okay, so you should remember this. Similarly, decrease in a powder and liquid ratio, it also increases the solubility, okay, and decrease in pH, it also increases the solubility, so you should remember this. So decrease in powder to liquid ratio, and pH, it increases the solubility. Similarly, our another point is it also dependent upon the water, okay, so solubility of the cement also depends on the water, okay, so marginal loss is due to the high solubility, okay, so this is a disadvantage, as it is more soluble, so it is highly soluble, so it causes the marginal loss, marginal leakage is present there, okay, so this is its disadvantage. After that, there is aesthetic, this is the advantage, okay, so it is a tooth colored and translucent, okay, and aesthetically more approved than the dental amalgam, okay, so teeth colored and translucent. Similarly, refractive index matches with the enamel and the dentine, and over the time staining may occur, okay, due to the abrasive, okay, so due to abrasive there is staining over the time. After that also I have written here, okay, in the gap due to the dissolution leads to the black line, okay, so there is a marginal leakage, okay, so due to the marginal leakage there is appearance of this black line, okay, and also as I have discussed with those 2 points earlierly in the introduction portion of the cement. After that I have written, okay, so this is important, okay, so this is very important. So in mouth breathers, okay, we omit the use of we do not use the silicate cement in the oral cavity of the patient who used to breathe with the mouth, okay, so mouth breathers, okay, in those patients this is contraindicated because due to excessive breathing, okay, so flow of air over this restoration over this cement would cause the powdery and opaque appearance, okay, so it becomes powdery and it becomes meaningless, okay, so in mouth breathers we just do not use the silicate cement. After that, adhesion, okay, so it do not chemically adhere but have mechanical bonding, so it is also important, okay, so sometimes they can ask, okay, is silicate cement is bonded to the tooth structure or not, then at that time you should tell it is not adhering to the tooth structure, as it is adhering to the tooth structure by just mechanical bonded but no chemical bond is present as such, okay. After that, dimensional change, okay, so there is a slight contraction present, so that there is a little dimensional change also present here. So I have discussed all those 7 points, so just remember, okay, so mechanical properties, thermal properties, biological properties, solubility and disintegration, aesthetics, adhesion and dimensional changes, okay. After properties I will discuss with the manipulation, okay, so in manipulation, and this is our last paper of today's video. So in manipulation, the armamentarium, okay, so things that we require are spatula and the glass slab, okay, and powder to liquid ratio is 1.6 gram per 4 ml, okay, so this is data is very important, so 1.6 gram by 4 ml, okay, so there is a rapid folding of the powder and the liquid, it preserves the gel structure, okay, so during the mixing of powder and liquid, massive rapid folding of the powder and liquid should be done there to preserve the in order to preserve the gel structure, okay. After that, ideal mix, okay, if the manipulation is good, then there is a presence of the putty consistency with the shiny appearance, okay, so just remember those 2 points, putty consistency and the shiny appearance, okay, so ideal mix, putty consistency and shiny appearance. I am repeating it because it would be easy to remember you, okay, it would be easy to remember this by you, okay. So when there is increase in powder, okay, and when there is increase in liquid, so this is also important. If during the manipulation there is increase in a powder, there will be formation of the crumbly mix, okay, so there forms a crumbly mix. Similarly, if there is increase in a liquid, then it would cause the increase in a setting time, decrease in a strength, increase in a carriage and decrease in a pH, okay. So as a liquid contains the phosphoric acid, so pH decreases, strength decreases, and the liquid causes the more unreacted, okay, so for more time there occurs the setting reaction, so that setting time also increases, and also there is increase of the carriage, okay. Now other 4 things, okay, that are required for this manipulation, okay, so these 4 points are also important, okay, so everything are important, okay, you just remember this. After watching those video, okay, I request you to just go through the notes, okay, that I used to upload in my telegram, so you can join my telegram channel, okay, so there I upload the notes of every video, okay, as I upload in the YouTube, okay, after a few time I just keep the notes of those video, okay. So from those notes you can just revise this, okay. So you shouldn't have to make your own notes, okay. You can revise by those notes self. Just you have to watch this video and read that note, okay. So but you should do that, okay. After that, okay, so dry field, okay, so dry field, okay, so dry operating field should be maintained for the manipulation of the cement, okay. Why? Because it is required for the okay, because if water comes in contact, okay, if there is not a dry field, then there increases the solubility, as I have told there in my previous paper, that okay, so is also dependent upon the water, solubility also dependent upon the water. So as the water increase, there is increase in a solubility, so that okay, okay, if dry field is not maintained, there is increase in solubility with the saliva, and that would cause the marginal leakage and other disadvantage that I have discussed in a solubility, okay. So marginal loss can be occurring at that point, okay. Similarly, varnish coat, okay, so we can apply the varnish, okay. So about varnish I will discuss about the varnish in later videos, okay, in detail, okay. So you will know what the varnish is actually, okay. Okay, during I also feel difficult, I used to also feel difficult during those college lectures, okay. So in college, just the teacher told this is varnish, this is basis, this is liners, but the concept of those things, okay, basis, liners and the varnish is not even cleared in 90% of the dental student, okay. So that I will try to cover all those topic in detail, okay, so that you would have sharp concept in those topic, okay, and you won't make mistakes. So the varnish coat, okay, it prevent the contact with the oral fluid and prevent the dehydration. So okay, varnish coat is applied over the, so if this is a tooth, okay, if this is a tooth and I restore here the zinc silicate cement, so over the silicate cement varnish is applied, okay. So that varnish coat will prevent the contact, okay, it prevent the contact with the oral fluid and also prevent the dehydration. Similarly, the cellulose acetate stripe, okay, we can use this in order to prevent okay, prevent during the sitting, removed after the sitting, okay. So it helps to separate, okay, it acts as separating media, okay, between that silicate cement and the oral cavity, and after the sitting we can remove that. Similarly, in a single portion, okay, so when we are inserting the silicate cement, we should insert this cement, okay, in single portion, okay. Multiple portion can cause the decrease in the binding, okay. Force of proper binding and proper restoration is not happening there when we used to keep those cement in multiple portions. Similarly, in our another topic, that is finishing and the polishing, okay. So during finishing and polishing, we used to delay the finishing and the polishing, because finishing in the early days may cause the fractures of the margin, okay. So it is easy to understand. Okay, now I have prepared this diagram, okay. So in this diagram, what they want to tell that okay, it is a clinical step, okay. So when we use the silicate cement, okay, just think this is a cavity, okay, deep cavity. So at first when we use silicate cement, okay, so at first we should use zinc oxide usinal for the pore protection, okay. So this, it is used as a base here, okay. So and above that we use zinc phosphate, okay. We don't use the silicate cement directly, okay, as silicate cement directly, if they are used, okay, then it can cause the discoloration of the silicate cement, and that can cause the less in aesthetics, okay. So the zinc phosphate is separating the silicate cement and the zinc oxide usinal, okay, and due to this separation, it prevents the contact between silicate cement and the zinc oxide usinal, and leading to the, and it decreases the discoloration, okay. So just remember, silicate cement, after that zinc phosphate cement, and after that zinc oxide usinal. So zinc oxide usinal is it is a base here, silicate cement it is a restoring material here, and zinc phosphate it is just a separating medium, okay, that separate the silicate cement and the zinc oxide usinal, okay. After that there is a mechanical mixing, okay. So in mechanical mixing, it is kept in a gelatinous capsule, okay, and pre-portioned. So mechanical mixing is easy, okay. So what we do is powder and the liquid, okay, are kept in a chambers, okay. So I will draw a picture. So think this is a capsule, as we have seen amalgam capsule or not, okay, in our school, dental school. So if this is a septum, okay, and this side it is powder and this side it is liquid, okay. So we press this, okay, so we press from both the side, and the septum is break and powder and liquid are mixed, okay, in proper manner, okay. So it is quite similar with that of a dental amalgam capsule, okay. So I have completed all those important points, all those important topic from this silicate cement, okay. And this silicate cement is not so important in your exam, okay, theory exam or the viva exam, but as the use of cement started from this silicate cement, so that it is important. Okay, it is important for every dental student to study this. Okay, so I have prepared a proper note. Okay, so proper note I have prepared for the silicate cement 2. Okay, so you guys should just watch this video, and after that you can just read the notes of this video. Okay, so after reading 1 or 2 times this note, you will be clear. Okay, and just revising this chapter. Okay, after a few days. Okay, so the revision is the key to success. Okay, as everyone tells, if the revision is poor, then you would forget everything. Okay, you would forget everything that is present in this chapter. Okay, so that revision is must. Okay, after giving a big lecture to you guys, so I will stop this lecture here. Okay, so this was for today. If you love this video, okay, so do like, subscribe, and also hit the bell icon, and share with your batchmate. Okay, hitting the bell icon will update you my all the videos. Okay, so those video I upload in YouTube. Okay, so you got the notification of those video. Okay, if you hit the bell icon, so please do like, subscribe, and hit the bell icon. Okay, and also share this video, this channel with your batchmate. Okay, so that they could also study from those video. Okay, and stay happy, stay healthy. Tata, bye bye, thank you.